Hey everyone, and welcome back to the Deep Dive. Today we are going to get into some really interesting stuff about middle and older adulthood.
Ooh, I like this topic.
I know, right? We're talking about all the things like
All the things?
yeah, like the body changing and how people think differently as they get older, and like all the social and emotional changes too.
It's a lot.
Yeah, it's a lot.
But super important for nursing.
Absolutely. I mean, think about it. Like every nurse is going to work with people in these age groups.
For sure. And, a lot of people have these ideas about what it means to get older, but are those ideas right?
Well, that's what we're going to find out, right? We're going to look at some research, some real nursing insights.
We can separate fact from fiction.
Exactly. So get ready to maybe rethink some of those assumptions about aging. You might be surprised by what we find.
I'm ready.
Me too.
Yeah.
Okay, so first things first, let's get clear on what we even mean by middle and older adulthood.
Right, because it's not like there's a magic switch that flips when you turn 40 or 65.
Right, exactly. So when we talk about middle adulthood, we're usually talking about people between 40 and 65.
Makes sense.
And then older adulthood, that starts at 65 and goes from there.
But even within older adulthood, there's a lot of variation. Right?
Oh, yeah, for sure. It's not just one big group. We've got youngest old, middle old, and oldest old to show that there's a ton of diversity.
Right. It's like saying everyone in their 20s has the same experiences. Totally not true.
Exactly. Okay, so we've got our age ranges sorted. Now let's get into what's actually happening in the body as we get older.
The science of aging. I find this stuff so fascinating.
Me too. It's crazy how much we're learning about how our bodies work.
There are a bunch of theories, but I like to think about them in two big categories. Pre-programmed theories and stochastic theories.
Okay, break those down for me.
So pre-programmed theories, those are kind of like saying we have a built-in biological clock.
So we're destined to age a certain way because of our genes?
Well, not exactly predetermined, but there's definitely a genetic component. One example is the telomere-telomerase hypothesis. Have you heard of telomeres?
Maybe. Remind me.
Okay, so imagine your DNA strands have little caps on the ends, kind of like those plastic tips on shoelaces.
Oh, okay. I see.
Those are telomeres. They shorten every time a cell divides. And eventually, they get so short that the cell can't divide anymore, and then it dies.
So it's like our cells have a limited number of replications, then they're out of here.
Yeah, that's a good way to think about it.
But that can't be the whole story.
Yeah.
Right? There's got to be more to aging than just telomeres.
Oh, absolutely. There's also the neuroendocrine theory. It suggests that the control centers in our brain, the pituitary and hypothalamus, start to lose their effectiveness over time.
And that affects what exactly?
Well, they impact hormone production, which has a ripple effect on a bunch of other things in the body.
Makes sense. What else?
Oh, and we can't forget about the immune system. As we get older, our immune system kind of weakens.
Which explains why older adults are more susceptible to getting sick.
Exactly. So all those things, telomeres, hormones, the immune system, they're all part of the pre-programmed theories of aging.
Okay, that makes sense. But what about those stochastic theories you mentioned? What are those all about?
Stochastic theories are more about random damage that builds up over time. It's less about a predetermined lifespan and more about the wear and tear of life.
Okay, so a car that's been driven 1 million miles is going to have more problems than a brand new one.
Yes, perfect analogy. One example is the wear and tear theory. Our cells and tissues get damaged by things like sunlight, pollution, and even just the normal processes of our metabolism. And that damage just accumulates over time.
Okay, that's easy to visualize. And what about that theory about molecules getting all tangled up? I remember something about that.
You're thinking of the cross-linkage theory. It says that essential molecules in our cells start to, knot up and can't function properly.
And that affects?
Well, it can affect things like skin elasticity, so wrinkles, and even how our organs work.
Wow. So aging is this super complex combo of our genes and our environment.
Right. It's not just one thing.
I'm seeing a theme here. It's always more complicated than we think.
Pretty much. But, understanding these basic theories, it really helps us make sense of all the specific changes that happen as we get older.
Okay, so let's get into those changes. What's going on in middle adulthood?
Well, that's where we really start to see those biological theories playing out in real life.
So we're talking about those hormonal shifts.
Yeah.
Menopause and andropause.
Yep. Hormone levels start to fluctuate, they go up and down, but overall, they decline.
And that causes
a whole bunch of changes. For women, it's the end of their reproductive years, which can lead to hot flashes, mood swings,
And for men?
Men might experience things like decreased libido, they might feel more tired, and even changes in body composition.
Ah, so that's where the middle-age spread comes in.
Yeah, body composition definitely shifts in middle adulthood.
Mm.
We tend to lose muscle mass and gain fat, especially around the belly.
Ugh. And our metabolisms slow down, right? Like all those late-night snacks I used to get away with, they don't just disappear anymore.
It happens. But the important thing to remember is that these changes, along with just the normal aging process, they increase the risk for some health conditions.
Okay, like what?
We're talking about things like heart disease, type 2 diabetes, osteoporosis, those kinds of things.
So not just cosmetic changes.
Yeah.
This is serious stuff.
Right, and it's not just the physical stuff either. There's a lot going on emotionally and socially during middle adulthood, too.
Oh, absolutely. It's a time of big transitions. Like, think about careers. People might be at their peak, feeling burned out or thinking about switching things up.
Yeah, and retirement might be on the horizon.
Right. And then there's all the family stuff going on. Kids are leaving home, maybe starting families of their own, and parents are getting older and might need more help.
Exactly. It's like being sandwiched between taking care of kids and aging parents.
And all this while they're dealing with their own mortality.
Right. Like time is passing, and that can be a lot to process.
It sounds like it could be a recipe for a midlife crisis.
Well, it doesn't have to be a crisis, but it's definitely a time of reflection.
Yeah, taking stock of where they're at in life.
Exactly.
So how can nurses support their patients who are going through all this? It seems like a lot.
It is a lot, but there are things we can do. And that's what we'll dive into in the next part. We'll talk more about how nurses can help.
Sounds good to me. Looking forward to it.
Me too. Okay, so middle adulthood, check. Now let's talk about older adulthood.
All right, let's do it. Older adulthood. Where do we even begin?
Well, I think it's important to start by addressing some of those stereotypes we all hear about older adults.
Oh, yeah, those stereotypes. Like all old adults are frail and lonely.
Exactly. Or that they're, like, stuck in their ways and can't learn new things.
Or that they're constantly battling health problems.
Right. And, as nurses, we have to challenge those assumptions head on.
Why is that so important?
Because those stereotypes can actually be harmful to patients.
How?
Well, let's say an older adult is complaining of pain. If we just assume it's part of aging, we might miss an underlying medical condition.
That's a good point. We can't just dismiss their symptoms.
Exactly. We might also underestimate their ability to participate in their care or learn new information.
Because we assume they're not capable.
Right. So we have to approach each patient as an individual, regardless of age.
Makes sense. But, while we're debunking stereotypes, we also can't ignore the fact that aging does come with some unique health challenges, right?
Oh, absolutely. We talked about those biological theories of aging earlier, and they start to manifest more noticeably in older adulthood.
So let's talk about those challenges. What are some of the most common health issues that nurses see with older adults?
Well, the leading causes of death in this age group are heart disease, cancer, stroke, Alzheimer's disease, and diabetes.
Oh, wow. Those are some heavy hitters.
Yeah, those are big ones that we see across the lifespan, but they become even more common as people age.
I'm guessing those chronic illnesses contribute to other health problems too, right?
Oh, absolutely. One specific concern with older adults is polypharmacy.
Polypharmacy. Remind me what that is.
It basically means they're taking multiple medications.
Which makes sense if they're managing multiple chronic conditions.
Right, but it can get complicated quickly.
How so?
Well, each medication has its own potential side effects and interactions with other drugs.
That sounds like a recipe for trouble.
It can be. So nurses have to be really careful about medication management with older adults.
What does that involve? Like, what do nurses actually do?
A lot. We educate patients and their families about their medications. We monitor for any adverse reactions. And we advocate for adjustments if needed. It's like putting together a puzzle, making sure all the pieces fit together safely.
Wow, that's a lot of responsibility.
It is. And speaking of complications, let's talk about delirium.
Delirium. That's like a sudden change in mental status, right?
Right. It can involve confusion, disorientation, hallucinations even.
So it's not the same as dementia.
No, it's a distinct condition. Delirium is usually triggered by something acute, like an illness, medication side effect, or even a change in environment.
So an older adult who's hospitalized after a fall, for example.
Exactly. The unfamiliar surroundings, the pain meds, the stress, it can all lead to delirium.
Okay, I get it. But why is delirium such a big concern? I mean, it sounds scary but temporary, right?
Well, the problem is that delirium can trigger a cascade of negative events. We call it cascade iatrogenesis.
Meaning?
One problem leads to another, and it just snowballs. So that older adult who's delirious after a fall, they might become agitated, pull out their 5e, try to get out of bed.
And injure themselves even more.
Exactly. And those injuries might lead to more meds or procedures, which increases the risk of more complications.
Wow, it's like a vicious cycle.
It really is. So we have to be super vigilant about preventing delirium in the first place.
Makes sense. What about depression in older adults? How does that play into things?
Depression is actually a big problem in this population, but it's often missed.
Why is that?
Well, the symptoms of depression, like fatigue, sleep problems, loss of appetite, they can be mistaken for normal aging.
Or attributed to their physical health problems.
Exactly. And older adults might be reluctant to talk about their mental health.
So nurses have to be really attuned to those subtle signs.
Absolutely. We're often the ones who spend the most time with patients, so we're in a good position to pick up on those cues.
Okay. And then there's the issue of elder abuse, which I know is a tough topic, but an important one.
For sure. Elder abuse can take many forms: physical, emotional, financial, neglect. It's not always obvious.
So it's not just about physical violence.
Right. It could be a caregiver withholding meds or a family member stealing money.
Or even just isolating an older adult from their social network.
Exactly. And nurses are mandated reporters, which means we have to report any suspected cases to the authorities.
It's a heavy responsibility, but it's about protecting vulnerable people.
Absolutely. And that advocacy extends beyond reporting abuse. It's about creating a safe environment for older adults, respecting their autonomy, and making sure they have access to resources.
It's about seeing the whole person, not just their age or their health conditions.
Exactly. And that's what we'll talk more about in the next part. We'll dive into how nurses can actually promote health and well-being in older adults. It's not just about managing decline, it's about helping them thrive.
I'm looking forward to that conversation. This is all really fascinating stuff.
Me too.
Okay, so we're back and ready to talk about how nurses can really make a difference in the lives of older adults.
This is where it gets exciting. We've talked about the challenges, but now let's focus on the possibilities.
I like that, focusing on possibilities. But where do we even start? There's so much to consider.
Well, I think it starts with understanding that aging isn't just about decline. It's also about growth, adaptation, and resilience.
So like shifting our perspective.
Exactly. Instead of focusing on what people are losing, let's focus on what they still have, what they're gaining, and how we can support their strengths.
I like that. It's a more holistic view, right?
Absolutely. And it's more person-centered, too. Every individual ages differently, so we can't just have a one-size-fits-all approach.
Makes sense. Like their health is influenced by so many different factors. Their genes, their lifestyle, their environment, even their social circumstances.
Right. Think about things like access to healthcare, socioeconomic status, education level. These are all social determinants of health that can have a huge impact on how we age.
The social determinants. We talk about those a lot in nursing.
For good reason.
Yeah.
They can create disparities in health outcomes and even reinforce those negative stereotypes we were talking about earlier.
So it's not just about providing direct care. It's also about advocating for social justice and policies that create a more equitable environment for aging.
You got it. It's about using our voices and our influence to address those systemic issues.
Okay, big picture stuff. But what about on a more practical level? What are some specific things nurses can do to support healthy aging?
One key area is maintaining physiological reserves. Think of it like your body's backup system, the extra resources it can tap into when you're stressed or sick.
Okay, I'm following.
As we age, those reserves naturally decline, which means older adults might have less wiggle room when it comes to bouncing back from illness or injury.
So it's like their bodies are less able to handle those big hits.
Exactly. That's why prevention and early detection are so crucial. We want to catch those potential problems before they turn into something serious.
Okay, so we're talking about things like regular checkups, cancer screenings, immunizations, all the preventive stuff we learn about in nursing school.
Absolutely. But it's not just about physical health. Supporting cognitive function is super important too.
Because our brains age too, right?
They do. But that doesn't mean cognitive decline is inevitable. We can do a lot to support brain health.
So what can nurses do in that area? What are some practical tips?
Even simple things like clear communication can make a huge difference. Using sensory aids like hearing amplifiers or large print materials, creating a calm and familiar environment.
So it's about minimizing those extra challenges so they can focus on engaging with the world around them.
Exactly. And don't underestimate the power of social connection. Encourage activities, reminiscing, and life review. Those things can be incredibly therapeutic.
It's like honoring their wisdom and recognizing that aging isn't just about loss. It's also about growth and reflection.
Beautifully said. And speaking of honoring their wisdom, let's not forget about autonomy. Older adults have the right to make their own decisions about their care.
Right, autonomy is important at every age.
Absolutely. It's about respecting their wishes, even if we don't agree with them, and it's about advocating for their right to self-determination.
Okay, so we've talked about physical health, cognitive function, psychosocial needs, autonomy. What else are we missing?
Well, there are some basic but essential aspects of care that we can't overlook. Things like nutrition, sleep, elimination, activity.
Wait, those sound like nursing 101. Why are they so important for older adults?
Because those basic needs can become more challenging as we age. Think about decreased appetite, difficulty swallowing, changes in sleep patterns. Those are all things we need to assess and address proactively.
So we can't just assume they're eating enough, sleeping well, and going to the bathroom regularly.
Right. We have to be paying attention to those details and advocating for their needs.
Okay, this has been super helpful. Last question, what about the future of aging? What trends are you seeing that will impact how we care for older adults in the years to come?
Ooh, that's a great question. One big trend is that people are living longer and staying healthier for longer.
So old age is kind of a moving target.
Exactly. And that means we'll need new models of care, more interprofessional collaboration, more focus on prevention and wellness, and more use of technology.
Technology, like what?
Telehealth, remote patient monitoring, things that allow older adults to stay in their homes and communities as long as possible.
That's amazing. It's like we're bringing healthcare to them instead of the other way around.
Right. And there's so much potential for technology to improve their quality of life, from assistive devices to social media platforms that combat isolation.
Wow, it sounds like the future of aging is pretty exciting. I'm feeling hopeful.
Me too. And nurses are going to be right at the center of it all, using their skills and compassion to help older adults live their best lives.
Well, this has been an amazing conversation. I've learned so much.
Me too. It's been a pleasure.
And a huge thank you to all our listeners for joining us on this deep dive into middle and older adulthood. We've covered a lot of ground today, but hopefully you're walking away with a deeper understanding of this fascinating stage of life and the incredible role nurses play in supporting older adults. So until next time, keep learning, keep exploring, and keep diving deep.